Hello everyone, and thank you so much for joining me for this presentation today. My name is Davidge, and I am an infectious diseases pharmacist. Today I will be presenting on common misconceptions regarding HIV and AIDS. I'd like to thank PFLAG Plymouth-Canton for inviting me to speak about this topic in honor of World AIDS Day, which is observed annually on December 1st. Since HIV and AIDS is a complex topic, I won't be able to review it in its entirety during this presentation. Instead, I've elected to focus on 8 common myths about HIV and AIDS and corresponding facts with updated information. Now to discuss our first myth. HIV and AIDS are the same thing. Fact: HIV does not equal AIDS, and so we cannot use these terms interchangeably. So, since we often hear about HIV and AIDS discussed together, what is the difference between these two terms? HIV stands for Human Immunodeficiency Virus. This refers to the virus itself that causes HIV infection. In contrast, AIDS is Acquired Immunodeficiency Syndrome, and this refers to an advanced stage of HIV infection in which the immune system has become significantly damaged by HIV. It's important to know that not everyone infected with HIV has AIDS. There are specific criteria that can be used to diagnose AIDS in a person who is infected with HIV. First, we look at the CD4 count. A CD4 T cell is a certain type of cell in our immune system that helps the body to fight off infections. The reason this is important for HIV is because HIV attacks and kills CD4 cells, and this impairs our body's ability to fight off different infections. As a result, once the CD4 count falls below 200 cells, that means that the immune system is significantly impaired, and so this is one of the criteria to define AIDS. Other AIDS-defining conditions are certain opportunistic infections or cancers that happen in patients with AIDS because their immune system is so suppressed. Some of these AIDS-defining conditions include Kaposi's sarcoma, pneumocystis jirovecii pneumonia, abbreviated PJP, and tuberculosis. Myth: being diagnosed with HIV infection or AIDS is a death sentence. Fact: at the beginning of the HIV epidemic in the United States in the 1980s, patients diagnosed with AIDS often only had 1 to 2 years to live after their diagnosis. However, a study published in 2016 demonstrated that in the United States, life expectancy for patients living with HIV approaches that of the general population. Specifically, in HIV patients, they estimated that the average life expectancy is 74 years, compared to the general population, which has an average life expectancy of about 80 years. Persons living with HIV may have a higher risk of developing comorbidities earlier in life, and these comorbid diseases may include heart disease, diabetes, and certain cancers. As a result, it's especially important for persons living with HIV to remain regularly engaged with their healthcare providers, because this will give them the opportunity to prevent and treat any of these comorbid diseases, in addition to managing their HIV infection. To expand upon this fact, unfortunately at this time, there is no cure available for HIV and AIDS. However, HIV and AIDS can be controlled with highly active antiretroviral therapy, which is sometimes referred to as HAART. If a person diagnosed with HIV takes their antiretroviral therapy as prescribed, this can prevent the vast majority of complications associated with HIV and prevent progression to AIDS. Myth: only men who have sex with men are at risk for becoming infected with HIV. Fact: in 2018, there were almost 38,000 new HIV diagnoses in the United States. Of these, the majority, 69%, were in individuals who identified as gay, bisexual, or other men who have sex with men. However, as we can see in the yellow box, 24% of new HIV diagnoses occurred in heterosexual individuals. Furthermore, 7% of new HIV diagnoses were among people who inject drugs. So it's important to know that while men who have sex with men are at an increased risk for acquiring HIV, they are not the only group who is at risk for acquiring HIV. While the majority of new HIV diagnoses in the United States occur in men who have sex with men, this is not true worldwide. This graph shows that men who have sex with men, represented in yellow, make up only 17% of new HIV infections that occurred globally in 2018. Furthermore, 46% of new HIV infections occurred in what they refer to as the remaining population. So this is the population that does not have some of the traditional risk factors we might associate with risk of HIV infection, including men who have sex with men, persons who inject drugs, and sex workers and their clients. Myth: HIV can be spread through contact with any bodily fluids. Fact: not all bodily fluids can transmit HIV. HIV can be transmitted in blood, semen, vaginal fluids, rectal fluids, and human breast milk. As we can see in this diagram, HIV can be transmitted through sexual contact, sharing needles to inject drugs, and from mother to baby during pregnancy, childbirth, or breastfeeding. There's also theoretical risk of transmission of HIV through receiving blood transfusions or organ donations. Now in the United States, we have strict testing procedures in place to prevent this from occurring, so the risk is exceedingly low. HIV is not transmitted through the air or water, through body fluids such as saliva, sweat, and tears, by insects, including mosquitoes or ticks, and by sharing toilet facilities, food, or drinks. Myth: persons living with HIV are always at high risk for transmitting the infection to others. Fact: we can measure the amount of HIV that is present in a person's bloodstream, and this is referred to as the HIV viral load. When an individual's HIV viral load remains less than 200 copies for at least 6 months, they cannot transmit HIV to their sexual partners. This is referred to as U equals U, which stands for undetectable equals untransmittable. So any person living with HIV whose HIV viral load in the bloodstream remains undetectable will not be able to transmit the virus through sexual contact. This was demonstrated in a study of almost 60,000 couples who were serodiscordant. This means that one partner was HIV positive and the other partner was HIV negative. This study identified no cases of HIV transmission from the HIV positive partner to the HIV negative partner, as long as the HIV positive partner had an undetectable viral load. This is why it is so important for persons living with HIV to remain adherent to their medications. Adherence to medications ensures that the HIV viral load remains undetectable and therefore ensures that HIV cannot be transmitted through sexual contact. Myth: the only way to prevent HIV transmission is to avoid all high-risk behaviors. While it is true that abstaining from sex and injection drug use are effective ways to prevent HIV transmission, other strategies may be used to reduce the risk for transmitting HIV. These strategies include wearing condoms or barrier protection during sexual contact, reducing number of sexual partners, using clean and sterile injection equipment if using injectable drugs, and getting tested for HIV, particularly for persons who are at higher risk for acquiring HIV infection. There are also medications that can be used to reduce the risk for HIV transmission. These medications fall into two groups, PrEP and PEP. First, PrEP stands for pre-exposure prophylaxis. This refers to taking medication before a possible exposure to HIV in order to prevent the transmission of HIV. Daily PrEP involves taking one pill once a day to reduce the risk for HIV transmission, and if used consistently, this daily PrEP can reduce the risk of sexually acquiring HIV by more than 90%. Similarly, using daily PrEP can reduce the risk of HIV in persons who inject drugs by more than 70%. PrEP is recommended for anyone who has unprotected sex with an HIV-positive partner or a partner whose HIV status is unknown. PrEP is also recommended for anyone who shares needles to inject drugs. In contrast, PEP means post-exposure prophylaxis. So this is taking a medication soon after a possible exposure to HIV in order to prevent the acquisition of HIV infection. PEP is recommended for anyone who may already have had a possible exposure to HIV. This may occur via unprotected sex, a sexual assault, sharing injection drug equipment, or occupational exposures, such as a healthcare worker who experiences a needle stick injury. PEP must be started within 72 hours of the possible HIV exposure in order to be effective, and therapy should be continued for a total of 28 days. Myth: HIV treatment regimens require taking handfuls of pills multiple times per day. Fact: the first highly active antiretroviral therapy regimens, approved in the 1990s, required patients to take up to 20 pills per day. As you can imagine, this would be very difficult to take consistently. Now, there are several antiretroviral drug regimens that have been developed that only require a person to take one pill once a day, which is much more convenient. Some of these regimens are shown on the right side of this slide, including Biktarvy, Genvoya, and Triumeq. Each of these pills contains multiple medications, and the reason for this is that if HIV is treated with only one antiviral medication, there is a risk that the virus will mutate and become resistant to that medication. Once a virus becomes resistant, that medication will no longer work to treat HIV. Instead, we use multiple medications to attack the virus in different ways to reduce the risk of the virus developing any resistance. Now for our final myth: there's nothing I can do to help combat the HIV and AIDS epidemic. Fact: even if you're not a healthcare provider or an individual who is personally affected by HIV and AIDS, there are many ways to get involved. First, if you feel comfortable, correct misinformation when you hear it. Share what you know, including what you might have learned during today's presentation. I would also encourage you to keep learning about HIV and AIDS. On the next slide, I will provide a number of resources that can be used to learn more about this topic. If you have the financial means, consider donating to HIV nonprofit organizations and research funds. These support the healthcare for current individuals who are affected by HIV and AIDS, and also promote scientists' ability to complete research that might be used to develop future medications for treating and preventing HIV, including possible development of a vaccine and hopefully eventually a cure for HIV infection. You may choose to volunteer with a local HIV service organization and advocate and vote for expanded healthcare access. This will benefit both individuals living with HIV as well as the general population as a whole. This slide lists a number of online resources that you can use if you are interested in learning more about HIV and AIDS. Additionally, if you or someone you know is interested in being tested for HIV, the last link provided here is a CDC website that will provide information about free testing services that are available based on your geographic location. Thank you all so much for taking the time to listen to this presentation. I hope you found the information helpful and have a great rest of your day.